Cats are masters at hiding illness. It's an instinct from the wild, where showing weakness could cost them everything. That means some of the most common cat diseases can progress quietly for weeks before you notice anything's wrong. Here's what every cat owner should actually know. If you've got a cat at home, hit subscribe. This channel covers exactly this kind of stuff. Let's start with the viruses. Feline immunodeficiency virus, sometimes called feline AIDS, is a lifelong viral infection that weakens the immune system over time. It spreads mainly through bites, so outdoor and unneutered cats are most at risk. Many F-positive cats show no obvious symptoms for years, but their weakened immunity leaves them vulnerable to other infections down the line. There's no cure, but with neutering, indoor living, and good veterinary care, F-positive cats can live long, comfortable lives. Feline leukemia virus spreads through close contact, shared food bowls, mutual grooming, or from mother to kittens. It mainly affects younger cats and can cause vague symptoms like weight loss, low energy, vomiting, and gum inflammation. Over time, it can lead to serious secondary conditions, including certain cancers. Cats that test positive need to stay strictly indoors to avoid spreading it to others. FIP, or feline infectious peritonitis, is a serious condition caused by a mutated coronavirus. It comes in two forms: a wet version that causes fluid buildup in the abdomen or chest, and a dry version that affects multiple organs. Historically, FIP was almost always fatal, though newer antiviral treatments have significantly improved outcomes when it's caught early. Feline panleukopenia, also called feline distemper, mostly strikes kittens and young cats. It attacks fast-dividing cells, especially in the gut and bone marrow, causing fever, vomiting, and severe diarrhea. It's highly contagious and can be fatal without supportive treatment, but it's also one of the diseases a routine kitten vaccination schedule protects against entirely. Beyond viruses, one of the single most common reasons cats end up at the vet is urinary trouble. Interestingly, it's rarely caused by bacteria. It's usually diet and low water intake, leading to crystal formation in the bladder. Those crystals can clump into stones, which irritate the urinary tract, or, in serious cases, block it completely. A cat straining to pee, making frequent trips to the litter box, or producing little to no urine needs a vet visit immediately. A full blockage is a genuine emergency. Older cats face a different urinary risk: chronic kidney disease, which develops slowly and often shows up first as unexplained weight loss before progressing to excessive thirst and urination. Quick one: if your cat's ever had a urinary scare, drop a comment below. It's more common than people think, and it helps other owners to hear it. Parasites are another common culprit. Internally, worms are the big one. A bloated belly, dull coat, weight loss despite normal appetite, and chronic diarrhea are all red flags. Externally, the most common problem isn't fleas or ticks, it's ear mites, tiny parasites that infest the ear canal and cause a dark coffee ground-like buildup, along with intense itching and head shaking. Both are very treatable once identified. Then there's a modern problem: obesity. A significant share of house cats worldwide are overweight, and it's a major risk factor for joint problems, arthritis, and, critically, type 2 diabetes. In diabetic cats, cells stop responding properly to insulin, causing blood sugar to spike. Watch for excessive thirst and urination, weight loss despite a good appetite, and, in advanced cases, a strange flat-footed walk caused by nerve damage in the back legs. Cats also get colds, usually viral, causing sneezing, watery eyes, and mild lethargy that clears up on its own with rest and good food. But if the discharge turns thick and colored, or breathing becomes labored, it's likely a secondary bacterial infection that needs veterinary treatment. Tumors are less common but serious. They can appear as small lumps under the skin, some benign, some malignant, and prone to spreading. Any new lump is worth having checked early, since outcomes depend heavily on catching it in time. A few cat illnesses can actually pass to humans. Ringworm is a contagious skin fungus that spreads through contact. Cat scratch disease can develop from a bite or scratch. And Toxoplasmosis, a parasite spread through cat feces, poses a real risk to pregnant women, since a first-time infection during pregnancy can cause serious complications for the baby. The common thread through almost all of this: prevention works. Vaccinations, regular vet checkups, parasite control, a balanced diet, and simply handling your cat often enough to notice small changes. These catch problems long before your cat could ever show you an obvious symptom. None of this replaces an actual vet visit. If something feels off, don't wait it out. Your cat can't tell you in words, but now you know what to watch for. If this helped, subscribe for more, and let me know in the comments which of these 5 surprised you most.